Le Nissan Kick-Play 2025 a beaucoup de plus. Apple CarPlay intégré pour jouer vos tunes préférées, des fonctions avancées de sécurité, un rendement énergétique remarquable, puis même la petite odeur de char neuf qu'on aime tant. Tout ça en plus pour moins. Le Nissan Kick Play 2025 est le véhicule neuf le plus abordable au Québec. Achetez-le à partir de seulement 22 774 $, incluant un rabais à l'achat comptant de 2 600 $. Profitez de cette offre avantageuse chez votre concessionnaire dès maintenant. Jusqu'au 2 mars, des conditions s'appliquent. Détails chez Nissan.
All right, welcome back to the Elias Makos Show, third hour of the program, and we will start off by taking a look at the federal dental program. Now, Quebec says it's not going to allow the federal dental program to apply to the province's public institutions. As a result, children, seniors, people with disabilities are all struggling to access dental care, all because Quebec is prohibiting health establishments from managing claims to the federal dental care plan. Of course, Quebec says that the plan is interference in its jurisdiction, and healthcare, of course, is a provincial jurisdiction. Let's go to Dr. Doug Hamilton, a dentist at Westmount Dental Care, and full disclosure, he's my dentist. Dr. Hamilton, welcome back to the show.
Hi, Elias. How are you today?
I'm doing good. And I know you're busy. Okay. You're often end up in surgery and stuck in emergency situations. And I want to thank you for taking the time for us.
Well, I'm happy to be here.
Sure. So let's take a look at the Canada dental plan. What is your take on its implementation so far? How is it going?
Well, I think it's going very well, considering the way it sort of came about. I think it's a bit of a political hot potato, I don't think a conservative government ever would have allowed this to happen. The Liberals and NDP have made it happen, and they kept it quite secret and then launched it very unprepared without really discussing with the dental profession. But in spite of that, it has rolled out pretty well. So there are thousands and thousands of treatments that have been done so far. We are treating about 40 patients a month on the plan so far, and the numbers are growing. So our seniors who are covered are extremely happy. That's mostly the population that we've seen so far. They're delighted. And so this is a very popular plan. We're getting a lot of care done, and a lot of care that people couldn't access before, particularly preventive care, which is so important. Is now possible. We have some problems. I was talking with Joel Antel, a friend of mine. He's the president of the Canadian Dental Association. He is negotiating every day with the government on how we can improve the plan. So there are administrative issues. We're working through them. And there's access issues. For example, poor people who do not file taxes have no access to the plan right now because the way in is if you show your income. Well, they don't file because they have no income, and therefore they have no access. So we have to work through these issues. But the rollout so far, I would say, for those that have gained access, it's very successful.
I want to ask you something that may be hard to judge, and maybe all the answer is anecdotal, so I don't know how good the answer can be, but I do want to ask it regardless. The people who are now using the Canada Dental program at your practice, are they people that would have never been getting these services, or are they people that were paying before out of their own pocket and now they just realize, I can get the government to pay?
So what we're seeing now is that a lot of seniors who weren't coming in very much or not accepting treatment recommendations are now very happy to receive services. Or I have one patient, does not have a lot of income. She comes in once a year for a cleaning, and it's a struggle for her to pay for one cleaning a year, is now able to come in 3 to 4 times a year for a cleaning, and she needs that to support her mouth. She has a lot of difficulty. When she comes in, it costs her $15, and it used to cost her $300. So this is a big deal for this particular patient. This is going to allow her to save her teeth. Without this care, she's going to lose many teeth over the remaining part of her life. So for a lot of people that are on limited income, they simply take the services that they can pay for, which is not very much. And sometimes they avoid completely the dental office and come in with emergencies, which are usually very expensive disasters. So this will allow us to keep these people out of trouble. And like I say, the appreciation level that we've had so far is really high. There is some confusion. A lot of people don't know if they qualified. They've been sent paperwork. They don't understand it. So for us, the administrative burden is huge. Tara is asking patients every day, have you registered? Are you eligible? And people are saying, well, I got something in the mail. I didn't know what to do with it. So she's registering people and getting them online, helping them out with that.
We're with Dr. Doug Hamilton, dentist at Westmount Dental Care, talking about the Canadian Dental Care Plan. Dr. Hamilton, can you make the case here that because the people that knock the plan say, boy, it costs a lot of money, right, to deliver this. But can you make the case that long term, if seniors take care of their teeth now, it could save the healthcare system more money in the long term?
I think those numbers will have to be processed. Let's just say on an individual basis, the quality of life that we can help people maintain if they can have regular, ongoing preventive services is huge. It's just huge. And for example, we know now that people that have teeth and can chew, the chewing stimulates the brain. The Alzheimer's it descends, it breaks down into ruin much more quickly in people that have no teeth. Uh-huh. People that have no teeth don't digest their food. They can have bowel blockages and whatnot because there's no teeth down in the gut, right? They just get blocked up. It's painful. You might need surgery, and sometimes they have very bad health outcomes. So if we maintain the teeth, health-wise, is very important. But if we maintain the teeth comfort-wise, the pain, abscesses, these kinds of things can be prevented. Uh-huh. And doing a simple preventive treatment is so much less expensive than doing the restorations, placing implants, extracting teeth, doing root canals. It's so much more expensive to do the reparative dentistry. The goal is to keep these patients out of the dentist chair. I haven't seen any analysis of a nationwide dental plan and how much money it saves or costs the government. But in terms of individual health experiences and life experiences, it's a godsend.
And before I have to let you go, I want your thoughts on the fact that the Quebec government is not allowing, vulnerable patients in the public system to access this plan. What are your thoughts on that and the back and forth between Quebec and Ottawa on this?
Do you really want to know what I think?
Yeah, I do.
Okay. Well, Elias, it's not that hard. The government does three things, most of our budgets. They go to roads and highways and maintaining that infrastructure. It goes to education. It goes to healthcare. That's most of the government budgets. Are you happy with the roads? We've got so many orange cones in Montreal. It's terrible. Are you happy with education? 35% of Francophone men don't graduate high school or are functionally illiterate. And now there's an assault on universities with all these new changes to eligibility. For example, McGill has gone from 200 students in the MBA program down to 35 students this year in the MBA program. Wow. And now their budgets are totally upside down. This is a disgrace. And we come to healthcare. Doctors and nurses are overworked and overstressed, and I don't understand it when my dental assistant hasn't had a doctor visit for 6 years. She's been waiting for a GP. And I know right now thousands and thousands of your listeners are saying, oh my God, I don't have a doctor either. It is so common. Patients ask me every day, do you have any way I can get into a doctor? Do you know anyone? We graduate 1,000 doctors a year and in medical schools in Quebec, and they don't give them permits to practice in Montreal. So what is really going on here? I think the medical system is in terrible shape, and talk to doctors and nurses. It's in crisis, or it's already in a state of collapse. Now the federal government comes along with some money for dental health care, and they say no to these people who they control based on some kind of principle of access to care. Look, take care of their teeth, because if they don't in these institutions, and these are some of the people with the worst conditions possible, if they don't take care of them, then they need major therapy, which is really expensive and very painful. It's just going to lead to suffering. Why don't they just let a doctor move? Look, my dad passed away a couple of years ago. He was in the St. Anne's Hospital, the Veterans Hospital, and they have a little dental clinic there, and they can do some dental care. Why not let them go in there, a dentist go in, and under the plan, treat these people? It doesn't cost the government anything, and they have a facility to deliver the care. But on a principle of jurisdiction, they're going to make these people suffer. I am dumbfounded. I am confused. I'm just so disappointed. It's just so disappointing that they won't support this.
That's dentist Dr. Doug.
That's what I think.
Doug Hamilton, who is currently a dentist and a future radio commentator, if he keeps it up right there. Thanks, Dr. Hamilton, for your thoughts.
Elias.
That's Dr. Hamilton from Westmount Dental Care.